Well, there's finally a way to get rid of that double chin without surgery.
This one. The Food and Drug Administration has
Like
approved.
I said, just keep doing this.
I don't think that works.
No, it doesn't.
Now you can just inject something into the fat in your chin and it will melt away magically. I know. But check out these before and after pictures. It's called Kybella. It's an injectable substance that dissolves fat under the chin, so it helps minimize the appearance of that double chin we all hate in selfies. Now, prior to Kybella, the only way to get rid of a double chin would be to cut it or suck out the fat. It's all surgical.
Or Photoshop.
Or a really good Photoshop
Right.
app. Kybella will be available in doctors' offices in June.
All right, so joining us now to explain how it works, Dr. Sandra Lee. She has her practice in Upland. Okay, so how does it work? Seems pretty simple. Just inject it and it just disappears?
Yeah, it is. It's really an interesting kind of modality that we have now because it doesn't require surgery.
Right.
It's non-invasive. It takes literally 5 minutes treatment. There's really usually up to 6 treatments and they're spaced monthly, but it doesn't take very long. Minimal side effects. What they mainly see is a little swelling and a little localized bruising, which you'd see with anything, with any kind of injectable. And the results are potentially permanent. So that's really nice.
Who can use it? Is this for someone with just like a little sagginess, or is this for someone with like 3 chins, like,
that's a really good question.
Overweight?
Because I think that's really important. It's not for everybody with a double chin. It is for people that have fat there. So you're going to have fullness. You're going to be able to pinch and squeeze and really grab onto something. Somebody who has what we call a turkey neck, or really loose skin, that flops a little, moves around a little bit. That's the kind that's not going to help because it can't tighten the skin. It's going to actually, it's actually deoxycholic acid. And what that is a naturally occurring acid in our gut that absorbs fat, that breaks it down. So when we inject this in the area, it actually works to break down the fat cells, and your body absorbs them naturally.
I think I find it interesting that you say that this could be permanent, because I almost looked at it as like Botox or something where you have to keep coming back and inject it over and over and over again.
Don't. Well, you have to do it a few times, but potentially you won't have to do it again. I mean, we get older, continue to age, and fat continues to accumulate in some areas that we don't necessarily want it to accumulate.
Right.
So I can't say, never, but when you remove fat cells from a place, they don't regenerate.
So let me ask you this.
Yes.
The FDA has approved it for the chin.
Right.
Could we see using this?
That's what we all think. That's
on
what
the
we're all
old
thinking.
love handles or the old arm curtains?
I think that's down the pike. I mean, I think that's going to happen potentially, but this is something that is approved in a very small area, and because of safety concerns, I'm sure, over time we may find out more about it. So it's very new, but the nice thing is it's FDA approved. They consider it to be safe product, and it's very exciting for all of us, for
Cost.
the whole double chin community.
Break the bad news. How much is it going to cost? Because insurance isn't going to pay for this thing.
We don't know yet. I don't know yet.
We don't know yet?
I think that the price point is going to be something, I don't know because it was just FDA approved, like literally the other day.
But you do a lot of procedures, so you have a general idea.
A general idea, if you had to guess.
I'm going to guess it's going to be in the thousands. It's
per,
going to be in the thousands. But permanent
injection,
thousands.
or
I'm going to guess probably in the 1,000 per injection. Somewhere in that range. I certainly don't think it's going to be $100 an injection.
Right. And we could soon see it in doctors' offices since it's FDA.
I think that you can call offices, and some of them may be getting them as soon as tomorrow.
Whoa.
So we'll see.
Unbelievable.
I'm calling them.
You're going to get it.
Oh, yes.
I want it. I'm stuck with a photo app filter for a while.
Yeah, those help, though, too. So those
so
are
I
nice.
can save up.
Remember.
Thank you, Dr. Sandra Lee.
When you take the picture, just kind of tilt your head,
Right.
stretch it out a little bit.
Jut your face out.
Thanks, Dr. Lee.